This is directed towards all of us, all of our board members. And one thing I'd especially like to ask is that if someone is speaking, they have the floor, they're making a point, please let them finish. And then everyone has an opportunity to ask questions or make comments. So, having said that, can we have a roll call, please?
Mr. Deal,
Here.
Dr. Henry,
Here.
Mr. Prater,
Here.
Mr. Pig,
Here.
Ms. Davis.
Here.
Okay, thank you. Welcome, everybody. Dr. Henry, could we have a reading of the Health Department mission and vision, please?
The mission is JCHD will champion positive health outcomes and behaviors through innovative programs and community engagement. The vision is advancing the health and safety of Jefferson County.
Okay, thank you. So our first order of the day is to approve the agenda. I have a motion to approve the agenda, please.
I'd like to make a change to the agenda. I would like to move number 8 under new business up directly under the approval of the agenda.
Second.
Okay, so we have a motion and a second to make an amendment moving new business item 8 up to the next item under approval of agenda. So any discussion on that? We do have a lot to do today. I'd really like to get through things. I think it'd be good to get this debated and finished. So any other debate on that?
Like to be recognized, sir.
Yes.
Leaving it where it's at would be a good idea, only because there's going to be some information given out this during this meeting that may or may not affect the outcome of that particular thing. So I think we should have that last. Keep it last, like it's on there.
Okay.
It's a good idea.
Any other discussion? Okay, all in favor of the amendment to the agenda, please say aye.
Aye.
All those opposed? Okay, so that amendment passes.
I make a motion that we approve the amended agenda. Second.
So a motion and a second to approve the agenda. Any other discussion? Hearing none, all in favor, please say aye.
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 Anyone opposed? Okay, so according to the amended agenda, first item is consideration of extension of the expiration of Health Director Order 20-11-25-11 to January 28th, 2021, which would be the date of our next meeting.
Chair, the
Yes.
date in the order says the January 21st, 2021.
I can advise about that after consulting with the county executive. They were not willing to extend it for more than 30 days, so by the order says 21st. The agenda was initially drafted, it was 20.
Okay, so the date would be the 21st, is that right? Okay. So the extension then would run until January 21st. Okay. So can I have a motion on the extension of the order, please?
I move that we would not extend this order due to the overwhelming response we've gotten from the public. And according to the numbers that we are seeing now, everything is coming down already. and it has been prior to this order. It's continuing to come down. And I do have some information to share on that if anybody would like to hear it. And also, so that's my motion to rescind the order.
Okay. So we have a motion not to extend the order, correct? All right. Do we have a second?
Second.
All right. Any other discussion on that? Okay. So pay attention to this. All in favor of not extending the order, please say aye.
Aye.
Okay. All in favor of extending the order? Oh, I'm sorry. All opposed to not extending the order? Please
No.
say aye.
Aye.
Aye, whatever. I make a motion that we accept the extended order as written.
I second.
Okay. Do we have discussion on that?
I'm going to have to definitely speak for the people on this matter. We're seeing that right now our rate of infection, which is according to the COVID Act organization that reports on this regularly as of 12/21/20, we see that we are in a very medium risk in our county right now at 0.95, which is less than 1. At the beginning of this, we saw it as high as 2.5. So in that regard, we're doing well. I see on the chart that we are given through the health department, this particular chart, if anyone watches it like I do, you'll see that in week 50, we have 69.33 on a rolling average of 7 days per 100,000 population, which according to the Harvard metric that Kelly wanted us to adopt, puts us in the red to light pink. The White House would put us into orange right now, if we were going by that. So I look to see that in the prior week reporting, we had 83 cases. We have now 69 on a rolling 7-day average. We were at that point at the beginning of November. So we are headed back that way again. Right before that, we were at 42, and right before that, it was 23, which is where right after that, we went into, quote, the red. Again, if we were using the White House metric, it would still be yellow at that point. We're doing good. We're moving back in that direction. I'm seeing, according to the Missouri State website, Show Me Strong Missouri, stating that we're at 14%, which is excellent. Moving back towards 12% and on down is where you want to be. I'm noticing that for 4 weeks now, 1, 2, 3, 4, we are at 0% deaths in our county. According to this, I'm not saying there hasn't been deaths reported, but according to this chart, that's public information, public record, what we post on our website, it says we've had 0 change in deaths per week. 0, 0, all the way back to the beginning of November, mid-November, whatever, a whole entire month. I am seeing that we're not noticing a problem with the COVID in our county as far as deaths and very sick people, other than the people that are vulnerable. And why should we penalize people that are healthy, don't have symptoms, they're not sick, they're not carrying a fever? Why should we expect them to feel less human than they are and ask them to do things like put a mask on their face when they feel like that is dehumanizing. They
Okay.
feel like that is, taking away the right to breathe fresh air.
Okay.
And I'm speaking for, I know you'd like for me to be quiet, but I'm speaking
No, I'd
for,
like you to wrap it up, please.
I understand. I'm speaking for a large amount of the community that feels like this, that regularly email all of us. And I know that if you read their emails, you will see that they're very, very upset about this because the numbers are good and coming down. They're not going up. And I'll also mention too, that in our ICUs, we are seeing an average of 8 to 10 people in ICU and in the regional hospitals, and about half of that number on vents.
Okay.
This is a manageable number, and our governor, I'm going to say this, our governor has already contracted help to come in to the hospitals as we need them, as the hospitals need them. They're already contracted and paid. They're
Okay.
sending them to,
Miss-
that was our concern too.
Ms. Davis,
was
we
that-
need to move along here. Does anyone have any else?
I have the floor and I will wrap it up, but I do
Mr.
need to
Chairman,
say
may I have the
this.
floor to put correct
Excuse me.
information?
I do need to say this.
No, let her finish.
Okay.
The governor himself has spent billions of dollars or however much it was to contract health professionals, doctors, nurses, etc., to come into the hospitals to help out as they're needed. And that was one of our concerns, was that we would, if we don't do this mask mandate, blah, 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 that we're going to contribute to the overwhelming of our own hospitals. Number
Okay.
one, it's not happening, even though people say, oh, it's going to happen, it's going to happen. It's not happening. But when and if it does, the help is already contracted to come in. There's no reason for our county to put this kind of measure out there and scare people.
Mr. Chair, if I may, I'd like to move to call the question, please.
Well,
And I still have the floor, and I
I
haven't
move to
given it
call the
up
question.
according
That
to
ends all
what you said at the
discussion. And
beginning.
now the vote's supposed to take place. Thank you.
I would call the question, but I want to see if there's any other discussion.
Is there anybody else that wants to discuss? Because I still have something I need to say. And I'm
Okay,
speaking for the
hearing-
people. You're not
hearing-
allowing people to come in
Hearing no.
and speak.
will
So
call-
I'm speaking for them. They've asked me to say these things, Dennis. It
We-
won't take me but a couple more minutes. Just saying.
I've called the question,
Number
sir.
one, the hospitals will have the help they need.
Ms. Davis, you've told us
Number
that
two,
3
it's
times.
masks dehumanize people and cause fights. Number three, our numbers are coming down than they were before the mask mandate went into place, or whatever you want to call this. Okay? All right.
Okay, I'm calling the
So I'm just
question.
giving you plenty of reason not to do this.
Okay, so we have a motion to extend the order and a second. Hearing no other discussion. Everyone in favor of extending the order, please say aye.
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 All those opposed?
I,
Okay, so that passes 3-2. So the order is extended until January 21st.
Mr. Chair,
Yes, sir.
I just wanted to mention again, we've had some emails coming in from patrons of businesses stating that the businesses have said the health department is putting fines and penalties on them for not enforcing things. I just wanted to say that that sort of statement is nowhere in this order. So
Thank you, sir. That's correct. All right. So we move on to section 5, approval of minutes and expenditures.
I make a motion, we approve the November 23rd, 2020 minutes.
Second?
Okay, I have a motion and second to approve November 23rd minutes. Any discussion? All in favor, please say aye.
Aye.
Any opposed?
I,
Okay, we have one opposed. That motion passes. Those minutes are approved.
I make a motion, we approve the November 25th, 2020 meeting minutes.
Second.
Okay, I have a motion and a second to approve those November 25th minutes. Any discussion? All in favor, please say aye.
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 Anyone opposed?
Aye.
Okay, that motion passes.
I make a motion to approve the November 2020 expenditures for an amount of $190,116.03.
I second.
Motion to approve those November expenditures. Any discussion on that?
I'd like to see and hear a report about how it's going with our contact tracing company.
Okay. Kelly,
Excuse me,
can you provide-
hold on. We have a motion on the floor. We have a second. That wouldn't be part of the discussion of the approval of minutes and expenditures at this time. That had to be at another time, sir.
All right, we'll revisit that. Any other questions or discussion? Okay,
I'm fine with it.
all in favor of approving the November 2020 expenditures, please say aye.
Aye.
When opposed? Okay, those are approved. Next is approval of the November 2020 electronic payments.
For $429,183.13.
I second.
Okay, a motion is second to approve those electronic payments. Any discussion on that? Okay, all in favor, please say aye.
Aye.
Anyone opposed? Those are approved. And finally, pre-approval of the January electronic payments, January 2021. Have a motion for that?
Motion to approve the amount of $486,213.25.
Second.
Okay, a motion is second to pre-approve those expenditures for January. All in favor, please say aye.
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 Anyone opposed to that? Okay. Next item is the director's report. Ms. Volmer?
May I interject? Could you answer Ms. Davis's question about the funding, please?
The relationship with our contact tracing company has been very well received. They have provided excellent support for us and enabling us to continue being able to do outreach to new cases, which we were beyond our capacity to do. We are looking at later on in the agenda, extending that contract for a period of time to maintain the level of capacity that we are currently experiencing.
Could you email us some kind of a report on that, Kelly, please? I guess if you could make it as of the end of December. Okay, thank you.
I don't know about the rest of the board. I'd like to understand exactly what they are doing for us and how it is contributing to what we're doing in our county to try to make things better. I'd like to know, like, in realistic terms on what it's actually doing, how they work with you, what they're doing, what you're doing.
Putting it in small words, they're doing the interviews for us so that we can keep up with our new cases. So as we get lab results in, we need to reach out and educate all of the new individuals who receive a positive test. Those individuals are then expected to isolate for their 10 days. And they are continually followed up on by the case contact company. So that the individuals with Maximus have provided the ability to do about 3 times the workload that we were capable of doing, in terms of they have 100 people doing what we could have 30 people doing. So the ability to reach out and to limit we've been able to catch up on our cases as they're coming in so that we are able to get individuals isolated faster, which means that you have fewer risks of individuals spreading it within the community because you're quarantining contacts. I am not going to get this. I apologize. I'm going to look down here so that I'm talking into the mic rather than up that way. The first slide that I'm showing you is from the St. Louis Pandemic Task Force and from our partners at SLU and WashU. We're looking at the new COVID admissions from the prior week. And what we're looking at is per 100,000 by county groupings. So as you can see, the metropolitan area, Jefferson, St. Louis City, St. Charles are all experiencing large numbers of admissions in the previous week. St. Louis City and County continue to have large admissions, but so do the outlying counties. Next. The next slide is putting this into a bit more perspective. So when we look at the new admissions per 100,000 from the prior week, so the week of 12/8/2020, we see that Jefferson County is number 4 ranked in terms of the number of new admissions per 100,000. So last week, Jefferson County had 64 new admissions, which put them at 28.53 as the rate per 100,000. We are just under St. Charles and St. Louis City. So again, we're right there with our peers. Next. The next slide shows our cumulative COVID-19 admissions per 100,000. So it includes the hospitalizations to the Pandemic Task Force hospitals from the week of 9/15 through 12/8/2020, sorted from by highest to lowest admissions per 100,000. Again, Jefferson County with 608 admissions during that time period is number 4 ranked on the list. So we're seeing about 271 admissions per 100,000. Next. The top chart is one that I've shared with you before, which is our rolling 7-day average of cases per 100,000. And at the time of this report, which was last Thursday, Jefferson was sitting at 69 per 100,000 on their 7-day rolling average. We are sitting at the same spot as St. Charles, which is one of the highest counties within the state at this point in time in terms of spread. Below this, you ask about death a lot. And so to give you a look at the new deaths in the St. Louis metropolitan area, the new deaths in St. Louis have continually grown since June, but have seen a significant increase since the holidays, beginning around the time of Halloween. Next. The reproductive number, or the effective reproductive number that I have for our past week, and again, our modeling takes place on Thursday with the task force, and so those numbers change every day as the numbers change every day. So the number that I have is 0.91 for our reproductive number. This is the equation that is used to get the proportion of the population that is susceptible at any given time. I will get the copy of that for you. Next. So to clarify some earlier discussion, we actually have week 51 on this chart, which, I'm gonna pull my glasses. I want to make very clear the difference between, and I'm gonna walk up here. These numbers here, which are the Harvard metrics, and these numbers here, which are the White House metrics. These are 7-day rolling average. It's a daily case count per 100,000. So you're looking at, for a 7-day rolling average, how many cases per day? So we're looking at 66.86. According to the Harvard metric, you need to be at 25 to be in the red. So we can forget this side of it. We'll go just looking strictly at the White House Pandemic Task Force. Looking along that same line, we see our weekly cases were 1,053. So our new cases per 100,000 are 468. well above the threshold for red. So these are marked.
Hold on, you
No.
still have to divide by 7 and then by 2.
Thank you. Mr. Chairman, may I continue? Thank you. So our new cases per week that are 468 per 100,000. When we look at our cumulative cases, another piece I would like to, what looks at or what the White House uses as their, yes, sir.
I'm sorry, I'm gonna ask her question for her. So the new cases per 100,000, the new cases per 100,000 per week that's not a 7-day rolling average, correct? On the White House.
No. It isn't.
There's
But we still have to compare apples to apples, and yes,
no.
they
it's a
do
different- it's a
expect you
different
to
matrix.
do
No,
it per
ma'am.
100,000
No, ma'am.
population and on
I'm
a
sorry,
7-day
I'm sorry.
rolling average.
No,
You
not
do
in that
compare
matrix.
apples to
Not on
apples.
that matrix. You
We
can't compare the
discuss
two.
this when Kelly's finished.
I'm sorry, you can't compare the two. Go ahead.
Okay, so the two pieces that the White House uses to be able to decide what the color metric is are the new cases per 100,000 per week and the percent positive. As you notice, both of these are in the red, and this is specifically in the darkest red. We are sitting at a 34% positivity rate for this week, which means 1 out of 3 tests was positive. One of the things that I would like to clarify is a lot of people are confused and think that more testing means you're going to have more positives. The reality is when we have less testing, we see more positives because you're not capturing as many of the individuals in the community. So when we look at our cases for this week, prior to this, it was, oh, sorry, thank you, Steve. In the week of 12/6 to 12/12, there were 4,008 tests completed in our county, and we had a positivity rate of 23.6%. Last week, for 12/13 to 12/19, there were 2,635 tests. So there was a pretty good drop. Our positivity rate was 34%. So when we're looking at these indicators, we are looking at multiple pieces of a puzzle. Regardless of what section of that puzzle you're looking at, in the White House, we've been in the red for at least the last 10 weeks.
That's not true. I'm sorry.
Okay.
We've been in the yellow, and now we're in the orange.
So as you can see, for the last 10 weeks, red, and over here, our percent positive, it was back prior to Halloween that we were on the orange as far as our percent positive. When we look at our change in diagnostic tests, so again, we're down 34% in terms of the number of tests that we've had for the week. When we're looking at deaths, the thing that is extremely, oh, sorry, didn't mean to touch that. It's extremely important to remember that with deaths, probable deaths are not included in the counts that the county has. So of the 31 pending deaths that we have, 13 of them are probable cases. Those cases, if they're antigen tests, they are not counted in the final death count. So there are people who test positive for COVID and are never counted in the positivity for the death count. The other piece to remember about deaths is the simple fact that unlike earlier in the pandemic, we were able to look at the death certificates to confirm that individuals had COVID on the death record. We are unable to do that anymore. The process is that the certificates go to the national level and then have to be evaluated for whether or not it was COVID related and sent back down to the state, and then we get them. That process can take 4 to 6 weeks. So the deaths that you're seeing here are reflective of 4 weeks ago, not now. So just as a guideline, does anybody have questions about the chart? Because I feel like we come back to this a lot. So I just.
Okay, so Kelly, the numbers of that we've had this week, okay, 485 cases, right? No, it's 1,000. Wait a minute, where'd it go? Then 1,496, correct?
Where are you finding 1,400?
Week 50. I can't see what you have up there
1,496. We don't have 1,496 on a week.
on week 50.
So the thing that you also have to remember is that that's a snapshot in time. So what you're looking at, if you're looking at last week's number, is you're looking at a snapshot in time from last week. We continue to get negative tests in, we continue to get other with death certificates and everything else in. And so during that time period, these numbers may change. So I'm assuming we're at this point, you're looking at the total cumulative case number of 14,493.
Correct. So then you would take that number and you would divide it by 7, rolling day average.
No.
Yes. You can look over here and see that that's what they did. And then you divide it by 2 because we have 225,000 people in our county. And that's how you get this 69.33 number.
No. And I apologize, but we've explained this several times. So let me explain again. This number here is a 7-day rolling average of COVID cases. So in the week that you're looking at, 156 cases. So that was our 7-day, every day we were getting on roughly 156 cases. When we look at that and we divide that by 100,000 residents, so our population is basically 225,000 residents.
Yeah.
So you take 156 and you divide it by 2.25.
Okay.
You get 69.33.
Right.
You don't find that a different way. The next one is their weekly cases. So again, 1,092, you divide it by 2.25. That's where that number comes from.
And I'm in total agreement with all that. But what you're trying to say is that the White House metric does something different, which is what Mr. Pig was trying to find out. And that they don't do anything different when it comes to figuring that number, that 69.33.
One's a weekly and one's a 7-day, right?
No,
One's a 7-day
they're
or
both the
one's a
same.
No, they're not.
They're both
So
exactly
I
the same.
appreciate the opportunity to be able to explain this
I know
chart
it's
and
just-
to be able to explain the thresholds.
The difference
The
between-
next pieces that
Could-
I
could
have
I
to be
just
able
say-
to look at.
Kelly, can
Yes,
I
sir.
just say real quickly, I don't know why we have disagreement among the numbers. I mean, we've never been able to agree, Ms. Davis. I don't know where you get your numbers or how you interpret them.
White
We've
House
explained
metric
it.
that they
We've
passed down for
explained
us
it
to use, and
to
we're not
you.
using it.
I think we need to sit down sometime and try to resolve those, but this is not the time or place to do that. And so, all I can say is I'm sorry.
Okay, I
we
have a
published-
question that
We
that
publish the
Kelly
numbers.
could answer if you don't mind. Can I do that?
One question.
Okay, so like on the Missouri site, when I go there, Kelly, it'll have the CDC, it'll have the picture of Missouri, click on it, goes to Jefferson County,
Mhm.
and then it gives us, I press percentages, and then I'm looking at the percentages for our county because I keep seeing the 20s, the 20s, the 20s.
Mhm.
So one of the maps has, when you look at it, it says that we're at 14%. And the other map says we're at 20-something%.
Okay.
So how are those so different?
So
Can you
what you're
explain?
seeing, and that may be the confusion, is that the past 7-day average, our positivity rate was 22.2%, according to the state site.
And how is that
The
figured?
14
Where do they get that from? How does that number
the
derive?
same way we calculate ours. You look at the total tests and the
Total
amount
number of tests
positives.
divided by what, population?
You look at the total number of tests and the number of positive tests, and you look at the percent, basically you're dividing your tests by your total number of tests to figure out how many are in the positive. It is a CDC guideline, and it has been evaluated, CDC method right here on
That's
the
fine.
screen.
You don't
It
have
says it
to-
reflects the total tests in the past 7 days divided by the total number of PCR tests. So I appreciate the opportunity to explain this because
Okay.
14% is actually the change in cases. So that's the percentage is not a percentage positive. That's a totally different
That's-
indicator.
It's going down, but it doesn't mean it's good.
correct.
It's heading in a good direction.
So quickly, I'd like to get through the rest of my slides because I know we have a lot on the agenda. The last couple of slides are, I apologize. I'm gonna have to go to mine because it's underneath on your, it's not showing on the top part. There we go. The first one is hospitalizations of COVID patients per 100,000 per zip code. So looking at, again, while we can't provide that detailed of information for our county, this I can get you to here. Next is the ICU transfers of COVID patients per 100,000. And the next slide is the deaths of COVID patients per 100,000 per zip code. And then the final slide I have is to demonstrate what we're seeing across the board in the metropolitan St. Louis area. Our new admissions have decreased over the last month, but they've plateaued at a very high number. So we're still over 100 admissions a day for our hospital systems, which is extremely taxing to them. What we're seeing though is while you're seeing new admissions come down, you're seeing hospitalizations maintain. So people are getting admitted to the hospital, but they're not going home. They're sicker. And the deaths consistently rising. Here, what this little spike is that you see is, remember I told you the 4 to 6 week window. We can't provide information we don't have. So as the information comes in over the weeks, those numbers go and they match out to where they need to be. But I feel like this is an extremely important slide to be able to show people are sicker. People are staying in the hospital longer and they're dying from this. So this is not a
Kelly, I'm sorry.
status man.
Can I ask you a question here at this point?
Thank you. I think it is extremely important to understand that these are not just numbers. These are people and families who are impacted by the deaths and by the hospitalizations. I encourage you to focus on more than that. What is your question?
Okay, so over the weekend, we were with some family members and we were discussing this very thing. And back in the fall, these family members had gotten sick with COVID. By the way, they were very, very strict on wearing masks and they still got it. But anyway, they said that their doctors never would prescribe anything for them. And in order to get a prescription for, like, if their lungs hurting and hard to breathe and all that, people literally have to go to the hospital to get a doctor to prescribe something. And there are people going in the hospital. That's why those numbers are high, because I'm watching it too. And they're staying 2 to 3 days average because they're getting what they need. Then they're going home. And then there are a few going into ICU. But that number has been consistently level. I mean, it's gone up. Don't get me wrong. But there are a large number of people going home. Today, 150 people went home from hospitals.
Ms.
So it's
Davis,
not
do you
they're getting
understand?
sicker. It's that this is progressing.
But do you understand that, especially looking at the chart we were just looking at, not everybody who goes home alive.
The
I
percentage,
personally experienced somebody who went home in a casket a week ago. So I would appreciate
the
it if you would
percentage
not
of
go there.
deaths is very low comparison to the
Chair, I would
population and the
request that we
number of
move on, please.
positives.
I request that we move on, sir.
I have our weekly reports that I will pass out for your review afterwards. Thank you, sir.
Okay, thank you. So our next items on the agenda are old business. First item is approval of the 2021 budget. We had a preliminary or draft budget submitted at the last meeting, and our packet today has a more comprehensive budget included. So, does anyone have any questions?
Yeah. I have one question.
Okay.
Telephone and telecommunications going up by like $92,000. I was just wondering what we're adding.
directly is being replaced, the older technology is being replaced. So the overall expenditure is going up, but not the grand total. So the difference raises to 9, but not an additional 9,000. So where our current IT telephony system contract is up, and we're moving forward to more robust that has more call features, better unified communication between the organizational personnel can communicate more effectively outside and a mobile remote capability.
I have a question about the indirect administration expenses. What is that concerning?
I apologize, I didn't have it open yet. Indirect and administrative. I will ask Kristen for clarification, okay. I say those are usually what are associated with our grants in terms of the oversight
Oh, okay.
and administration of grants.
Okay.
She can clarify when she comes in.
You know what? I see where it's coming in as a revenue and it's leaving as an expense. So it must be a grant.
Kristen said those are part of the grant.
Okay, thank you.
I make a motion that we accept the 2021 proposed budget
I second.
presented. Sorry.
Sorry. I second.
So we had someone coming with more information, or do we need that?
She just confirmed the account that it
Oh.
was associated with grants. It's the NNO.
Okay. Okay, so any other questions, any other discussion? Is everyone happy with the format this was presented in that we asked for?
Yes.
Looks good to me. Okay, so we have a motion and a second to approve the proposed agenda for calendar year 2021. All in favor, please say aye.
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 Anyone opposed? Okay, the budget is adopted. All right. The next item is approval of the table of organization. It's also in your packet. This year's probably presented a lot more opportunity, or I'm not sure if I should call it that, for changes in the table of organization because of all the unexpected work that needed to be done. So do you have any comment on that, Kelly?
Now, what we've tried to do with the alignment at this point in time is to be able to visualize both the COVID structure within our normal working structure, as we still have some staff that are straddling positions on both sides. And so to be able to create that accountability chain, we feel we have everybody accounted out correctly at this point.
I make a motion, we accept the updated table of organization as presented.
Second.
Okay, motion and second to approve the table of organization. Any other discussion on that? Hearing none, all in favor, please say aye.
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 Anyone opposed? So table of organizations adopted as presented. Okay, we can move on now to new business. Some of these items have been requested by board members. And so we're going to go through these. I want to caution folks, at least the people who are listening online to the meeting. There are a lot of issues that I think people think are pretty straightforward, and that can include things like testing, reporting, isolation, quarantine. But they can be a lot more complicated than people may think. So please keep that in mind. We may discuss some of those issues today as a result of these items. But if people have questions, again, because things are complicated, and I think that shows up when we're looking at data too. If folks are not familiar with some of these issues, they can be confusing. So be happy to provide people with more information if they need it. So having said that, first item is consideration of an amendment to Board Resolution 20-07-28-01 to require mask on JCHD property to allow for religious or health exemptions for board members. So we have a standing resolution. And so this item is asking to allow for religious or health exemptions for board members. So we have a motion to that effect.
I make a motion that as a health board member, we should not be required to wear a mask if we have a religious objection or a health objection. Change that last word to exemption.
I had a question. In our county order, do we have exemption? We have an exemption in place in the order, don't we?
Could you answer that, please, Kelly?
I was looking for I didn't see the document here. But where I'm going at with this, if we have an exemption in our county order, we should have one in our departmental one as well. That's my thought process on it. The language could be the same.
But each business department unit generally creates their own
And you're not wrong.
stuff
I
on
mean,
that.
that's just the way I view it. If we're going to tell county what to do, we shouldn't be any different. I mean, that's my thoughts.
Understood?
Can I provide some input to the board on this one? So under the Americans with Disabilities Act, and you can have rules and regulations for entering a building. And if you're a place of public accommodation, like the health center is, and you can request reasonable accommodation in order to enter that building. So by passage of your original resolution requiring that masks be worn whenever you're on Jefferson County Health Center property, you're essentially creating a rule for entering the building. Allowing for an exemption for a religious or a health issue would basically be asking for an exception to that rule. So under ADA law, you have to evaluate that exception as a request for a reasonable accommodation. It is up to the board to consider whether or not that request is in fact reasonable. And factors that can be considered whenever you're trying to determine reasonableness is the current pandemic. So in other words, something that you can look at is saying, okay, well, if somebody has asthma or they have a religious exemption to covering their face, do those interests outweigh the interests that drove the resolution to begin with? In other words, the public health. So if it is, you can basically say just to a person requesting the exemption, regardless of who it is, board member, member of the public, whatever, say that the interest of the rest of the people in the building outweigh the religious interest or the health exemption interest of that one person. And in doing so, though, what you would consider is whether or not there are alternative means of participation in the activity. So under the Attorney General's advice for conducting public meetings during a pandemic, public entities are allowed to hold completely virtual meetings. Like, you don't have to physically even be here to have this meeting today. You're allowed to have it virtually. So if the board were to enforce the resolution as written and say, no, you have to wear a face covering in order to enter the property, then the alternative is already set up for that individual to participate virtually. So if the board considers that not to be a request for reasonable accommodation, the compromise that has been offered already is the participation by virtual means.
So Christy, there are two different things. One is an ADA or medical exemption. The second one is a religious exemption.
The same evaluation applies, ma'am.
The religious exemption, not to go against what you're saying, comes from the 14th Amendment, Section 201.
Actually, no, ma'am. It comes from the First Amendment and the Missouri Constitution's free exercise clause, both of which allow for reasonable accommodation for religious exemption, and they are evaluating the same mechanism as a disability.
So I stand corrected. It is from the First Amendment, but it's from Table 2 and Section 201. And it does say all persons shall be entitled to the full and equal enjoyment of goods, services, facilities, privileges, advantages, and accommodations of any place, public place, due to the ground, accommodation as defined in this section without discrimination or segregation on the grounds of race, color, religion,
You're actually
or national origin.
You're actually reading Title VII of the Civil Rights Amendment or Civil Rights Act of 1964, not the First Amendment of the Constitution.
Right. It's Table 2, Section
201.
201.
Title 2.
So, like I was saying, is there are two different things. So, not asking for, necessarily a medical exemption, but it's very wrong to deny a person's civil rights in any circumstance. And just for example, recently the Supreme Court ruled that in New York, people were not allowed to gather. Okay, just say that. Okay, and they ruled that even in spite of a pandemic, the right to gather, the right to assemble, same constitution that's saying that people with a religious exemption should not be discriminated against and made to wear a mask when they feel like their face should not be covered. Okay,
So
that's a religious.
Okay, I'll just back up and try to explain this. You and I have had this conversation one-on-one, but I'd be happy to have it again with the full board. So under the First Amendment, which provides the right to peaceably assemble, right to free speech, the right to free exercise of religion, the government can set reasonable time, place, and manner of restrictions on those rights. And one of the things that we look at to see whether or not they are reasonable time, place, and manner of restrictions is what is the climate of the environment. And climate of the environment right now includes the fact that we are in a pandemic. So the same analysis that applies to whether or not something is a reasonable accommodation under the ADA, because Ms. Davis, you have asked for both a disability accommodation and a religious exemption, the same analysis applies. We look to see whether or not that request is reasonable in light of the climate, in light of the needs of the other people participating in the activity.
So you have evidence that, for instance, if I did not have this mask on, okay, do you have evidence that I am unhealthy? Is there
Ms. Davis, I don't need to have
proof that I'm
evidence
unhealthy, that I would make anyone in this room sick by having my mask off?
Ms. Davis, I don't need to have proof that you are healthy or unhealthy. The rule applies to everyone equally.
Mr. Chair, I'd like to go ahead and second this, and please immediately move to question, please. I second her minion, move to question. She made amendment, she made a motion, I second it. Call to question, please.
Repeat the,
Okay, so we have a motion.
We've already had discussion. I called immediate to move to question.
All right. Okay. Motion and
we
second
haven't
to-
finished the discussion. He didn't ask if there be any other discussion.
We had plenty of pre-discussion. I've called for a immediate move to question. Thank you.
That was not seconded.
I seconded it.
Cannot second your own motion.
Who seconded your motion? Okay, so I'll call the question. And again, keep in mind how this reads. So we're considering an amendment to allow for religious or health exemptions for board members.
That is correct. In consistency with what the order is that was just passed previously. Same rule, same exemption, same situation.
Okay, so we have a motion and second. So all in favor of allowing an exemption for health or religious reasons, please say aye.
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 All opposed, say no.
No.
So that motion fails. Okay, second item is approval of lease property. We've discussed this previously. There's an office a few doors down from the Hillsborough office that we're considering leasing to provide space for additional personnel, including social distancing and mitigation measures. So we're asking for this because we've hired temporary staff to assist with response to the pandemic. The lease is for a year because we're hoping that the pandemic will hopefully be resolved within that time, and the people that we're needing the space for hopefully will not be needed more than a year. So in explanation of that item, I'd like to ask for a motion to approve the lease of real property.
I make a motion to approve the lease of this property.
I second the motion.
I just had one question beforehand. Was that already accounted for in the 2021 budget? Okay, thank you.
Okay, any other questions or discussion? And that'll be effective as of when? Okay. All right, hearing none. All in favor of approving the lease of real property, please say aye.
Aye.
Anyone opposed? Okay, it passes. All right, next is consideration of change of duration of quarantine recommendations for positive cases. So again, we have a policy which recommends or at least sets a duration for quarantine for positive cases. And I think this is one of the items I was referring to earlier when I was saying that these things are not as straightforward as folks might think. One issue with this is that there is a difference between quarantine and isolation. CDC does set the standard for isolation for positive cases. And I am not sure if this motion intended to talk about quarantine or isolation or both. So again, not sure if anyone wants to make that motion, and then we can have some discussion on that.
So I move to adopt what CDC is recommending across the country for our county as well, to go no longer than 7 days in an isolation or quarantine, And that's what I propose.
Ms. Davis, so you're saying you want a 7-day period for quarantine and isolation?
Isolation being what we do if someone's positive. Quarantine, I'm not sure. They're similar, I know. One you have to do, one I don't get it. You might
Okay. well,
explain that or have
I'm
Kelly
not-
explain it.
I'm just not clear on your motion.
To adopt what CDC is doing in our county as well, no more than 7 days in isolation.
Discussion real quick on the CDC website. It says who needs to quarantine, and it starts talking about people who have been in contact with positive cases. And right here on their website, it does say 14 days.
For quarantine.
Yeah.
To stay
Isolation
home.
is 10, and we're following the CDC guidelines.
It's pretty
already.
complicated
already been-
because there's parts to where if you're positive and you've been so long, it's
Iso-
really complicated.
Yeah, isolation is if you're positive. Quarantine is if you've come in contact with someone that was positive. So the CDC changed their guidelines, and immediately the Jefferson County Health Department, because we'd already voted that we would follow what the CDC guidelines were. So when the CDC changed those guidelines, the health department immediately changed their guidelines. So we are currently following that. And it is a 7-day, if they are under quarantine, you can get out early if you test negative within 48 hours of the 7-day period. And the health department is sending notifications to people telling them that. My brother received a letter telling him that. So he tested early and got his negative result. So we're currently following that.
Okay, I'll drop that one. Sorry. We can move on to the next one.
So you want
Thank
to
you.
withdraw that motion?
Yes, I do.
Okay. Okay, the next item is consideration of elimination of quarantine recommendations for probable cases. Anyone have a motion on that?
I move that we no longer expect anyone that is probable to quarantine. And I believe this is going to, I'll just send it there, then we can have our discussion.
Have a second on that?
I'll go ahead and second just so we can kill the process.
Okay, so we have a motion and second to eliminate quarantine recommendations for probable cases.
Okay, so,
Go ahead, I'm sorry.
okay, so I didn't mean to jump ahead of you, I'm sorry. So we've got so many problems with trying to get the kids back in school. It is so important to get these kids back in school. So the bus driver or the teacher or somebody tested positive. So then all these people around them are probables. No?
No.
Okay. So to get people back in school, if someone has tested positive, why can't they use a rapid test? And if it says that they're no longer positive, they're completely out of isolation.
Mr. Chairman, may I? Okay. There's a couple points that I think are important to clarify. So one, probable cases are defined by two things. They're a direct contact to a known positive case.
Mm-hmm.
The other thing is that they meet the clinical criteria of symptoms for COVID-19. So basically, they've got COVID-19 and they've had direct contact with somebody we know is positive, so they have an exposure. The only thing that's lacking is a lab confirmation. but we are to treat probable cases with the same isolation guidelines as we use for positive
So
cases.
probable cases are actually showing symptoms?
Correct.
Yeah.
Okay.
But how many symptoms is what I'm concerned about.
What-
You know, you know, I have asthma and a runny nose from allergies, you know, you could say that would be a COVID symptom, right?
But there are several symptoms that are evaluated when an individual is evaluated for whether or not they would have COVID. And so there would need to be a significant number of clinical symptoms. It wouldn't just be somebody has a cough and they've gotten exposure. So what you're describing earlier with the bus driver is if they're positive and then the people around them would be contacts. So they're not considered probables, they're considered contacts, and that's where the quarantine comes into play.
So in this motion, what I'm trying to do is get these schools open somehow to where everybody isn't considered positive that aren't positive. How can we do that? How can we do that? Why punish everybody in the process when they're not carrying any, you know, symptoms? They just were in contact with a person.
So
Maybe they've already got huge immunities already. They're not going to get sick. You know,
to clarify, we do consider contacts separate from positives. So no one who is a contact, if a person is a contact to a case, but they show no symptoms and or they go through the 7 or 10 day and they test out they're negative, they would not be considered a positive case just because they've had a contact to a positive. They
Or-
have to have those symptoms which
or a
make them
probable case.
positive.
do you have a list of symptoms that people have to, you know, like what if I coughed? You know,
They're
I was
right
in
on the
contact with a
CDC
person and
website,
I
but-
came in the door here and you asked me these questions and, you know, yeah, I had a cough. You know, is that going to set off this big alarm bell? You know, everybody coughs, you know, you walk through the, you know, I mean, seriously.
Mr. Chair,
I mean, but that doesn't mean I
move
have
to call the
COVID.
question, please.
Yeah, I would just say
So-
that's a medical decision, Ms. Davis.
So what I'm trying to do is help reopen the schools 100%. How can we do this without taking away some of these unnecessary isolations or quarantines?
Mr. Chair, the school boards in Jefferson County set their policies for
Yes.
medical.
Are they?
We don't do it.
Are-
We go by cities.
Are they somehow
guidelines
using
that we
rapid
recommend.
testing or something, anything like that to help sort out?
Again, I move to call the question, sir.
Did you want to answer that, Kelly?
What I will just add is that the state has provided through the federal government what they call the Buy Next Now rapid test. It is up to the school whether or not they implement that. There are several factors which are included in that in terms of the ability to be able to dispose of hazardous waste, the ability to be able to do that test in an area where they won't be exposing other individuals. So there are a lot of things that come into play that may not necessarily make it an easy thing for the schools to do. So it is up to the schools. We are not part of that process at all.
And one thing I would say, Ms. Davis, is that, you know, we certainly understand, and I think everybody would like to see as many kids in school as possible. But again, we're specifically talking about probable cases here. And we explain the definition. And I think it's only for safety's sake that we can continue to follow what we've been doing.
It's just that I've heard where people have been put back into quarantine several times, like a particular teenager was on a ball team and due to different ones on their team testing or positive or whatever, and everybody around them were being penalized and put into quarantine again. And, you know, it's hard when you have 26 kids on a team or 30 people in a class or 40 people on a bus. You know, we've got to find something long-term, sustainable that we can do that'll help these people out so they don't have to worry all this, you know. I mean, the kids aren't really being as affected as the older and more vulnerable people anyway.
Again, I move to call the question, please.
Yeah. And again, I would just say this is specifically talking about probable cases. So, okay, so we've had a discussion after a motion and second. So The motion was to eliminate quarantine recommendations for probable cases. So everyone in favor of eliminating quarantine recommendations, please say aye.
Aye.
All opposed?
No.
No.
Nay.
Okay, so that motion does not pass. Okay, the next item is consideration of elimination of quarantine recommendation for students and staff who wear masks.
I move to place in a motion in those exact words in line with what the governor has recommended, to consider elimination of quarantine recommendations for students and staff who are wearing masks.
Second that motion.
Okay, a motion and second to eliminate quarantine recommendations for students and staff who wear masks. Any discussion on that? One thing I would say is that the guidance that the governor has issued is not in line with the recommendations from CDC. And I think as far as what Jefferson County Health Department has done is to follow the CDC recommendation rather than the governor's.
I think that we should consider his recommendation because he's in charge of the state trying to get the schools open. He's also got an advisory team that advises him that they've done their homework, they've done their research. CDC is kind of making and changing their rules as they go. I think we should go with the most current information, which is what he is recommending that we do, and for the purpose of getting the schools open and keeping them open. Because this is not sustainable what we're doing. We need to do something long term. This could be on us for another year. We don't know. We need something sustainable.
I do believe the
And
governor
that's why
also,
he's doing that.
sorry, I thought you were finished. I also believe that the governor made statements in there that local areas should be able to take care of and do other necessary things because it's a varied state. There are some places who have very little of the COVID. I shouldn't say very little, not as extreme as we do in the St. Louis area. So I think the governor was trying to just cover everything he could.
I can understand that, but I also see that our county is not doing that bad as far as the RO. You know, we're at or below 1, which is promising. And to be sustainable, we need our kids in school. No matter what, we need our kids, we need the teachers, we need the bus drivers, we need everybody back to school. So according to why the governor put this out that was what he had in mind. He didn't have in mind county by county, don't do it because of this ABC. He had in mind to please open these schools up, and he wanted everybody to follow this order.
It was a recommendation.
Right. It's a recommendation,
It
but
wasn't
that's
an
why.
order. I move to
think-
call the question, please.
I think the governor has been on both sides of the fence as far as the state making recommendations versus locals. So that's one issue. My other concern about this is I think it's very vague talking about students and staff who wear masks. I mean, what does that mean?
What does it mean? It means that if one of the people in that classroom or bus tests positive, but they were wearing masks, the other ones are not going to be put into quarantine. Only the person that tested positive is put into quarantine
How do you
or
know?
Think
How do you know someone was wearing a mask all the time?
Mr. Chairman, I've called the motion to question,
Yeah,
please.
I think we'll call the question on this. Okay, so again, eliminating quarantine recommendations for students and staff who wear masks. So all in favor of eliminating quarantine recommendations, please say aye.
Aye.
All opposed, please say no.
Nay.
No.
No.
Okay, so that motion fails. Okay, the next item is consideration of elimination of quarantine duration recommended for students and teachers
This is number
who,
6.
who rapid test negative.
I would point out that private statements withdrawing number 3, with the understanding that we are already following JCHD guidelines, and then number 6 is a moot point.
I'm sorry, Christy, I didn't hear that.
So by the withdrawal of number 3, with the understanding that we are already following CDC guidance for those who rapid test negative, and the current guidelines, what CDC says, number 6 is a moot point.
We're already doing that.
Yeah. Anyone question that? Okay, so
I would like to make a motion that rapid tests be used in the schools to help keep the schools open.
We do
However
not
they
have any
choose to use them.
jurisdiction.
We don't have jurisdiction over the school boards to require the schools to require rapid tests of their students or their staff.
Point of order. There's a motion on the floor.
I have a second.
We do not have jurisdiction.
Okay, hearing no second, that motion dies. Okay. Next item is consideration of requirement that PCR testing labs not exceed a 20 cycle threshold.
Do we have the,
That's kind of technical for folks listening, but I hope everyone here understands what.
do we
this
have
is
the
about.
ability to do that?
No.
Okay.
So does anyone want to?
I'll put this on the floor in the form of a motion so that we can have discussion. I'm curious myself. And then maybe we would decide yes or no, but consideration, I make a motion that the PCR testing threshold not exceed 20 cycles.
Ms. Davis, for the same reason that this, we don't have jurisdiction over the school boards, we don't have jurisdiction over the labs, they are required to follow CDC.
Motion's on the floor.
Do we have a second? Hearing none, that motion fails or dies. Okay, so gone through the new business section.
So got item
Oh,
9.
I'm
Number
sorry.
9,
There's a number 9 on the following page.
you want to
Okay.
make the motion?
And that item is approval of extending the contact tracing contract between Maximus Federal Services, Inc. and Jefferson County Health Department or Health Center.
I'd just like to know the duration of the extension. I'll make a motion to approve the extension of the contact tracing contract between Maximus Federal Services and the Jefferson County Health Department through the end of January 2021.
I second that.
Discussion?
So I would like to know, where will we get off this bus? You know, this contact tracing bus. You know, we're talking 1.6 million every 2 months, and it sounds like a lot of money to me. You know, where are we going to get off this bus? That goes to Kelly for
I don't think
question.
I don't think that dollar number is correct, is it?
No.
Yes.
I would say Jetty's looking up the cost at this point in time.
I
but
believe the contact tracing is a requirement from the state of Missouri, is it not?
It is.
Okay, so I don't think anybody has an answer to your question.
Well,
I
you
don't think
know,
there's a way to answer it.
is it a recommendation from the
No.
state
No, it's a
It's an
requirement.
order.
requirement? So we were doing that anyway. Okay. And now we have an outside company contact tracing for us. And they're, according to what I remembered on the contract, it was 1.6 million for 2 months.
The request was 1.6 million for 3 months.
3 months. Okay.
And I am looking down here. We have paid out, sorry, I'm just looking at the bottom of the November 2020 expenditures, $218,375, and then a second check of $293,099.70. So we haven't even spent 600,000 yet of that amount yet.
Thank you for that. It's good to know that clarification. I appreciate that very much. And I'm sure that the people listening would like to know as well.
Thank you.
I think as long as,
Just what do you forecast, Kelly? I mean, you're seeing what they're doing for you at, in contact tracing here in your department. What do you foresee?
The one thing we can be assured by a pandemic is that there are no assurances. There's no way to know. So what we can do, or what we know works best, and historically has proven to be effective. So contact tracing has been an effective tool utilized by public health for decades. The use of masks, hand washing, social distancing and mitigation measures have been an effective public health tool, as well as immunizations or vaccinations, which are now on the horizon. So all of those tools put together will be able to make a dent in the pandemic. But unfortunately, at this point in time, it is impossible to estimate when that will end.
So there's no way we can be assured that you'd like to try this another 30 days, another 60 days. There's no assurance from your side on what you'd like to see, because the reason we did this was to help relieve you and your department some of that stress and pressure. And just
It's an
wondering,
unknown. It's an unknown.
on a sustainable basis, what can we expect as a county?
So
That's why we're doing 30 days by 30 days. We're reevaluating it monthly. And when the need is no longer there, then we no longer utilize them.
The motion was to extend it through the end of January.
Gotcha.
they're amenable to doing a month by month contract.
So are they operating here, Kelly, out of our building or somewhere remotely?
No, they are not operating locally. Individuals are can be located anywhere across the state or throughout the country. We made several attempts for several months to hire individuals from the Jefferson County area to fill these positions, and were unsuccessful in competing against the metro areas for additional contact tracers, which is the reason why we had to outsource for a company to be able to do this, was because we were unable to fill those positions internally.
Okay, so I'm just kind of curious. So if somebody gets, what is it you call, put into isolation because they've tested positive, okay, then what happens if they leave their house? Is there some sort of a penalty, a fine? Is there, what exactly? I mean, you have the contact tracers, get a hold of them. They tell them they're in isolation, correct? Because they tested positive, which they already know they've tested positive. They've got that result, right? So they call them
They should
back. Is
have
that
that.
their job to do that? After they've tested positive, it's their job to call that person and explain things to them.
It is. It is part of the public health process. So in the contact tracing is most noticeably used in situations like tuberculosis cases, would be a more common example I think people would be thinking of. The idea being is to educate the individual on the risks of the disease, to quarantine them away from others so that they're not able to spread it to others, and to be able to follow that case all the way through. What has happened over the course of the pandemic is with 15,000 cases, we have not been able to follow case manage all the way through. So at this point in time, we are utilizing the resources that we have available to us to be able to do that education and to get those initial pieces done so that we are meeting our obligations to the orders for the state.
So that's very interesting. And so they're following the person through, and they're getting what, an exit report at the end?
So again, as mentioned previously, we are unable to follow an individual all the way through the contact tracing because of the simple fact we do not have the manpower to be able to do that. So that is basically the gold standard, is to follow an individual all the way through and to be able to do that exit interview and go forward. The ability at this point in time with the number of cases that are on the caseload, that is not a particular thing. We are not at this point able to manage all of the cases that are positive that are coming in, which is why we are working within the governor's recommended tier system, which one requires us to prioritize children 0 to 19 years of age and older adults living in long-term care facilities. So those are the cases that we are able to focus on at this point in time. We are doing a broad community campaign to educate the public about if they receive positive results, what steps they should take to help keep themselves and their family safe, as well as to inform individuals they're in contact with about what they need to do to quarantine.
I see. This is a company from another state, et cetera, et cetera. I'd personally like to see this go up for a bid if we're going to continue doing it sustainably for people, small businesses in our county, to embrace that bid, give you, okay, if XYZ is doing this, then let's put it out there in the county for contractors to come in and give you a bid to do the same thing, and then keep the money in our county.
So
people
that's
here.
a very good point. And normally during our bid process, as well as when we do contracts, we always are looking to prioritize Jefferson County businesses in order to ensure we're reinvesting in our community. With this company in particular, there's a couple of things. One, this did go out for bid. This was a bid through the state bid process. Anyone, including Jefferson County businesses, could apply and be approved to be part of this process, as well as the process for setting up the program to do contact tracing, and then as well training the staff, onboarding them, and getting the feedback and reports working. It's taken the 2 months that we've had with them to bring this full scale. So it's not something where you can just, next month I feel like I'm going to go to a different company, because there is a lot of prep work and infrastructure building that is required to be able to do this.
Mr. Chair, I move to call the question, please.
Yeah, I'm going to call a question on this. So
Could we in the future please have more information, though, whether it be, a report from her or something, because I still have tons of questions about this, and I know people in our county do too as well.
okay,
I have a need to get these questions answered somewhere, somehow.
okay.
So if he wants to call the question, I know he wants to move it along. He's not being paid to be here, but I really am interested in these questions.
All these questions have already been answered previously
No,
in
they have not
multiple
been
times
answered.
with multiple things. Yes, ma'am.
Just for instance, people in the county, I know there's people intelligent enough to run a small company like that to do this. I mean, literally, if they're just taking positive cases and calling them back and educating them, I'm sure somebody would be able to do that in our county. If we could put that back up for a bid. I never saw it on a bid myself. It went through.
How many staff do you think they're
It
providing?
went through the state, right? So it never came to the county. I never saw a bid out there in the paper
Well, through the state.
to ask for our
It
people.
was a state bid.
Right. So, I mean, they didn't even know about it. So I think they would love to help the health department out in that way.
Ms. Davis, I can tell you that I saw the bid go out from the state, as well as it was widely publicized. It was put into papers. It was distributed so that anybody across the state would have the opportunity to be able to bid.
I hear what you're saying, but what I'm saying is we don't have to go with that company, and we don't owe them anything. Why not, now that we know what it consists of, we've got the structural layout of it, why not put that into a bid for people in our county as far as businesses that might want to try to do that for you themselves, and then pick one of those.
So again, the time, expense, and infrastructure that is required to get a system of this magnitude created is, you're going to spend more money recreating the wheel than you would to be able to continue and be able to reach as many people as you need to. The other piece of this is, again, we're not expecting the pandemic to last forever. So this is something that each time that you have to break it and recreate the system, it is a major undertaking. The individuals, we are getting approximately 105 staff work for us for Maximus.
Okay, so I guess my question would be, how many cases are we dealing with right
I'm
now?
gonna call
And
the
how many people are being
question.
Thank you.
called? Just kind of curious.
So everyone in favor of extending the Maximus contract through the end of January? We have a motion and a second. So all in favor, please say aye.
Aye.
Any opposed?
Aye.
Okay. So we have issues for closed session. Can I have a motion to go into closed session,
I
please?
make a motion to enter into closed session.
Okay, a motion and a second to enter closed session. Could I have roll call, please? The purpose
Which one?
of the closed session.
So it's pursuant to 610.021 sections 1, 2, 3, 13, and 14.
Okay, roll call, please.
Mr. Deal,
Yes.
Dr. Henry,
Yes.
Mr. Prater,
Yes.
Mr. Peg,
Yes.
Ms. Davis.
Yes.